right, we'll go ahead and get started. So good morning and good afternoon, everyone, based on which time zone you're in. We got a pretty big crowd today, so I'm betting we have folks here from all over. My name is Luke Hansen, and I'm a program manager with the University of Alabama at Birmingham School of Public Health's Office of Public Health Practice. And I'm excited, and it's my pleasure today to welcome you to our webinar, Misinformation as a Risk Factor During the COVID-19 Pandemic. Our webinar will feature Dr. Katrine Wallace from the University of Illinois at Chicago School of Public Health. And this webinar is made possible by the Alabama Regional Center for Infection Prevention and Control, Training and Technical Assistance, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division, as well as the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, view and listen to past trainings, webinars, and podcasts, request training and technical assistance, and view infection prevention and control resources at our website, which is uab.edu/ARC-IPC. You can also email arcipc@uab.edu with any questions you have and to stay up to date about future trainings by signing up for our newsletter on the homepage of our website. We, of course, also want to thank our co-sponsor for today's webinar, which is the Region 4 Public Health Training Center, and you can learn much more about their programs and the center as a whole at the website listed here on the screen. We'd also really like to invite you to join us for our next webinar, which is Scientific Reporting During a Pandemic, a conversation with Dr. Catherine Wu. During the COVID pandemic, obviously media outlets have been tasked with translating complex and evolving scientific data about the nature and risks of SARS-CoV-2 to the public. In this capacity, journalists in these roles have had to stay up to date with rapidly evolving information, wade through misinformation, scrutinize data, and of course, amplify voices from underrepresented and marginalized communities at unprecedented speed to keep the public informed. In this webinar, Dr. Wu, who's a staff writer at The Atlantic, will join us for a conversation about her experience, challenges, and lessons she's learned while reporting on the COVID-19 pandemic. The webinar will also be presented by the ARC-IPC and co-sponsored by Region 4 Public Health Training Center. It'll be held on May 11th at 12 p.m. Central Standard Time. And so finally, it is my absolute pleasure to introduce our speaker today, Dr. Katrine Wallace. Dr. Wallace holds a PhD in epidemiology and has over 15 years of professional research experience in epidemiology, research design, pharmacoepidemiology, health economics, outcomes research, and biostatistics. She's currently an epidemiologist and an adjunct professor of epidemiology at the University of Illinois at Chicago School of Public Health. She's also known as Dr. Cat on her popular social media channels, where she educates on epidemiology, vaccines, and of course, the COVID-19 pandemic. She's been an invited speaker in the US and internationally and has presented research at over 20 scientific congresses. Vaccine advocate, Dr. Wallace serves as a member of the UN Verified Initiative, Team HALO, the World Health Organization's Project FIDES, and was chosen as a vaccine luminary for the 2021 G7 Vaccine Confidence Summit. Dr. Wallace has also been featured as an opinion contributor for The Hill and has been interviewed or profiled in several mainstream media outlets, including BBC World News, The Washington Post, Good Morning America, Bloomberg, CBS News, and National Public Radio. So without further ado, and being quite humbled having read through that, very excited to learn from you. I would love to turn it over here to Dr. Wallace. Dr. Wallace, thank you so much for being here today.
Thank you so much for that great introduction. And thank you to the ARC-IPC and University of Alabama for having me today. I'm very honored to be here. And I've been really enjoying seeing all your salutations in the chat while the intro is going on. And I see we have people from all over the country and even international. So I'm very humbled and appreciative that you're here today for my presentation. So as Luke was mentioning, I've been a science communicator on social media, and during the last 2 years, I'm going to kind of share what I've learned, which has been like doing a fellowship in another area as an epidemiologist. So let's get going. So today, my objectives for this talk is going to be to teach what misinformation is versus disinformation, because they're used interchangeably and they're not actually the same thing. We're going to provide an overview of how social media algorithms work and how they provide fertile ground for misinformation to spread. And then we're going to talk about how the misinformation on social media is actually a co-epidemic and how this has been a risk factor for more disease and death, and how social media has been used to weaponize health information. And I'm going to try to do my best to leave as much time at the end for questions because I'm sure there will be some. All right, so when we think about misinformation and disinformation, they both involve the sharing of false information. So in that sense, they're the same, but the difference between them is the intent of the information. So disinformation is purposeful spreading of false information with a ulterior motive of political gain, some kind of personal gain, or monetary gain. Whereas misinformation is just basically sharing information that isn't true. So like I like to say the difference between these two are like, you know, some kind of coordinated effort to get people to not take the vaccine because you're selling vitamin supplements or something would be an example of disinformation, whereas misinformation is like your aunt on Facebook sharing a meme or some kind of post that she thinks must be true because she saw another one of her neighbors shared it and doesn't have that same intent. So let's keep that in mind as we're working through this topic, because it's really important to know the difference and how these ideas kind of start and germinate and then how they proliferate and spread on social media. Okay. So belief in misinformation about COVID-19 is a lot more common than we think. So the source for this survey was the Kaiser Family Foundation in late 2021. And in this survey, they found that about 4/5 of people in the US believe at least one common falsehood about COVID or the vaccine. So this was even people that were kind of pro-vaccine were pretending to believe at least one false thing about COVID or the vaccine. So this was very shocking to people like me who try to counteract this kind of information online. And the fact that people are getting their information from social media now is also a real reason that we need to meet people where they are. So in this survey by the Pew Research Center, it shows that about half of Americans are getting their news about the pandemic from social media, you know, not the regular news or, you know, their doctor, they're getting it from social media. Because if you think about it, where were people in 2020? They were at home. They weren't, you know, at work talking to people around a water cooler. They were at home, pretty much working from home mostly. I mean, obviously there were people that were still having to work outside the home, but there were a lot more people at home than normal. And those kind of societal checks and balances of like, oh, did you hear COVID was a hoax? And then somebody around the water cooler says, nah, that's not true. That wasn't happening. So people tended to just be on social media sort of in their rabbit holes, and it got more and more polarized with the misinformation versus people that believe the science, and that kind of just went on, right? So people get their news now about the pandemic a lot from social media. And social media users are more likely to believe false information. If you see this, the part that I highlighted here in yellow, these are people that identified themselves as getting their information as their primary source of information about COVID-19 from social media. And as you can see, about 40% to 65% believe these kind of misinformation statements at the top, more so than people that get their news from the newspaper, from doctors, or from state or local leaders. So it's concerning because there is, like I said, the checks and balances on social media really aren't there, except for with some kind of community guidelines on the social media platforms themselves, which I'll talk about that. So I personally have a lot of my own experience kind of peppered into this talk because I really kind of can't separate the two. I try to be a serious academic, but I am a science communicator on social media, and a lot of the research that I've done in the last 2 years has to do with my own observations and my own experience. So I'm what you call an accidental science communicator. I started out as a professor of epidemiology, and I taught graduate students for all these years. And so I downloaded TikTok for the same reason everybody else did at the beginning of the pandemic, because I was bored during the lockdown. And in addition to seeing people's videos of their dogs and making food, I also unfortunately saw a lot of videos of conspiracy theories that COVID-19 was fake, or that it was a hoax, and that, all the deaths were miscoded. And so myself, in addition to, we have a little community of science communicators that didn't do this before the pandemic, but we do now. The one thing we all sort of have in common is that we were sort of motivated by this sense of duty. And me, as a public health scientist and epidemiologist, I really felt like I had a role to play in sort of trying to counteract this misinformation I was seeing, because I was trained and I knew how to interpret the data, and I felt like I could express it on social media in a way that was fun and easy to understand, boil it down. So that was my goal. So as you probably know, pre-2020, science communication was very different than it is now. Now it's sort of normal and more widespread on social media. But before 2020, that wasn't really the case. So historically, people were communicating their own science work, including myself, like presenting data at conferences or writing journal articles, doing interviews, maybe, posting results on Twitter, and also for myself, a lot of classroom teaching. So that's how we would communicate science, right? So people generally relied on the media or their doctors for their health information. You might hear about a breakthrough therapy on the news or something, and your doctor might say, oh, there's this new drug to treat, your allergies or something. You would hear from things that way. You wouldn't necessarily be privy to every scientific discussion. So now in 2020 and beyond, that all changed. So we had a lot of urgency, changing policies, and the volume of data every day that was coming out was very hard for people to sort through. There were debates that usually happened behind closed doors for just scientists that were now happening on a very public stage. Because of all of this, we started to have scientists and non-scientists engaging in this discourse, right? So this emergence of very loud voices that were not science voices led to politics, opinions, misinformation, and this culture of alternative facts. So science communication really changed in that scientists and medical professionals have become voices for the public, because many voices at this time had become untrustworthy. So that brings me to social media and what the pros and cons are for using it for science communication. So the pros are obviously that the very important public health tenet of meeting people where they are. As we saw in the previous research, people are getting their information from social media. It's a modality that's easy, and you can use it quickly to communicate data and information. It also makes important information fun if you're creative. The people that pretty much do the best on social media are people that can kind of harness both sides of their brain. You can be talking about science, but you're also, having the video be fun and engaging and, easy to watch, not just reading tables of data, right? So the cons, however, are that attention spans on social media are really short. If you don't hold people's attention, you're not going to get them to the important point of your video. Also, algorithm-driven platforms, which I'll talk about more, are definitely a drawback. And also that science communicators, anytime you're talking about vaccines online, especially with the lightning rod of politics that's been kind of interspersed into this debate, we get harassed a lot. So these are kind of some of the pros and cons. Another one just information thing is that when you this is something that I didn't know, and it's something that I definitely learned. If you really want to be successful as a social media science communicator, you need to learn to harness all the different platforms, because all the platforms have different demographics. So if you're just talking to one platform, you're really not getting your message across to the widest possible audience. So you should probably cross post on different platforms, and different misinformation and different issues occur on all the different platforms, which is another kind of fun thing I learned along the way. So some barriers to being successful in, spreading good information. The first one I want to talk about is the social media algorithms themselves. So in the social media online world, engagement rules. Engagement drives how often you see specific content. So if you like cats and you like pictures of cats, you're going to see lots more pictures of cats. If you are in New York City and you constantly interact with restaurants in New York City, you'll see more restaurants in New York City. This is just how it works. So somebody that has anti-science leanings is going to see more of that content. Like I never see that kind of content in my feed. My followers will tag me in videos that they see of those things to alert me that things are going on, but I will never see them in my feed because the algorithm knows I don't want to see it. The algorithm driven platforms are designed to keep you on the app. Engagement is everything. So it will favor sensational viral content always. And it doesn't matter if that viral content is good information or misinformation. If it's getting engagement, it will get more views. So in this environment, misinformation very often wins over evidence and data, because me standing there telling people to wear a mask is not as appealing to people's psychology than somebody saying, I have a secret that the government doesn't want you to know about COVID, right? So it's like human nature to want to know what's the real truth. And so in this environment, misinformation very often flourishes on social media. And in fact, the Washington Post did a study and found that misinformation got 6 times more clicks than real news over like trustworthy sources. The second barrier to good information on social media is that people are inherently bad at assessing their own risk. So people think that the risk of COVID is very low. Like you constantly hear this 99.999 whatever survival rate. And then people consider the risk from the vaccine as very high. They're hiding deaths or whatever you hear. There's also a naturalistic bias that people have, that man-made risks are perceived as worse than natural risks. So people think that getting natural immunity, they call it, from a infection is safer than getting it from a vaccine. So that's been a huge source of problems on social media, because there's a lot of videos with the hashtag natural immunity that if you look through them, it's just like constant misinformation. Then people have an optimistic bias also, and they think that their own risk is less than other people's risk. Like you hear, I'm young and healthy from a whole spectrum of people that you're kind of like, are you though? So this poor risk assessment has been a huge barrier to good information on social media. Third barrier is called the illusory truth effect. And this is fascinating in that the illusion of truth happens when people hear the same false information over and over again, repeated. They often come to believe it as truth. So this even happens really fascinatingly when people originally knew it was false. If they keep hearing it, they tend to start believing it. And this is absolutely happening on social media, because you see the same misinformation over and over. It just gets bombarded at you. So this is the perfect breeding ground for this. And this actually, the little picture on here is Barack Obama last week talking to Stanford University about disinformation. And he's saying it's not even necessary for people to believe the disinformation in order to weaken democratic institutions. You just need to flood a country's public square with enough raw sewage to raise questions. And that is exactly what disinformation does. It just has people pause and ask questions like, wait, that could be true. I've heard that a few different times. Another barrier to good information about the pandemic has been science literacy. And this was a surprise to me because I'm used to, admittedly, I'm used to teaching graduate students. So I didn't really realize the problem with science literacy that exists. And science communication with non-scientists had a lot of challenges at the beginning. So I did a lot of basic science videos, as you can see on the bottom, that just I could tag people in them if they had questions that were very basic questions, like why, the levels of evidence and not understanding that, a case study of one person is not equivalent to like a randomized clinical trial that's published in New England Journal of Medicine. People would send me, well, what about this? And it would be like, one patient, and I'm like, well, no, that doesn't prove your point. And so I had a lot of these kind of questions, and also things like when science would move on because it collected more data, it doesn't mean people lied before. It just means that we have more information now. So it was very interesting and also a little scary, but I did a lot of basic science education just because I felt like we needed it before people could even talk about COVID. So let's just review for a second of all the reasons why we were very susceptible to an epidemic of misinformation. We had a public discourse going on with some very loud voices that were not science voices. We had a science literacy problem. We had social media algorithms that were favoring sensational viral content. We had people's cognitive biases already. We all make decisions based on information that we already have on file. So there was that going on. And then there's this poor risk assessment that people have. So all of this together is like a perfect storm that was influencing people's individual beliefs about the pandemic. COVID-19 vaccine misinformation was sort of the next wave after the COVID is a hoax kind of information that was on the internet. And the co-epidemic of misinformation that we have led to a lot of distrust of public health recommendations. That's nothing new to anybody on this call, and vaccine hesitancy. And as you can see, there's everybody's familiar with this diagram. Who's in public health, there's people that refuse all vaccines, and no matter what you say or what you do, they're never going to get one. So we're not talking to that group of people. Then there's the vaccine adopters, the people that are in line at Walgreens the first day that their booster is, authorized by FDA. We're also not talking to those people because we don't have any influence over those two groups. They are already set in stone. The arrow in the middle is a very, very heterogeneous group of people. And misinformation about vaccines is causing this group of people to question, to delay vaccination, and this in turn is costing lives and slowing our recovery from the pandemic. So I feel like my role in doing good science communication is to build trust with this group of people and to help listen and respond to their individual vaccine hesitancy, because vaccine hesitancy is not one thing. It's very different in everybody. So there could be cultural reasons, there could be history, abuses from the medical system, there could be, worried about ingredients, whatever it is. There's different reasons people are vaccine hesitant, and we need to listen and be responsive. And a lot of the misinformation, the disinformation that's proliferating on social media is targeting this group of people and capitalizing on them. So we love in public health, we love, our health promotion models, right? So this health belief model is really kind of appropriate for social media science communication because, and I'm not going to go through this like I'm teaching class, but the things that we need to change in people is their perceived susceptibility of COVID. Like, you are at risk for COVID. We all are. Perceived severity. People think, oh, it's just a cold. We need to educate that it isn't just a cold in everybody. There can be severe illness, and sometimes it's not always clear who's at risk for that. Perceived benefits of the vaccine, perceived barriers, and then self-efficacy, getting people to feel good about being vaccinated and to understand all these things. So these are the things that we need to change in order to get people to do the health behavior we want, like get vaccinated or wear a mask or what have you. And the drivers so the influencing factors here, it's a very oversimplified model, but really when we're talking about beliefs, it's much more complicated, right? So we have all kinds of drivers of false beliefs, and these can be cognitive or socioaffective. And it all kind of feeds in, like we said, that circle that I went through at the beginning, all these external factors, but then there's also internal factors too. So changing these beliefs is not easy, but we try on social media to make it fun and teach and just at least get people to start thinking about maybe this thing that I was thinking is wrong. But knowing that people kind of have these cognitive biases and knowing that people have these false beliefs, disinformation spreaders are using these kinds of techniques to capitalize on that and to make sure that people stay in that mindset. And these things I'm going to go over quickly. I want to make sure I cover everything. But these are the main kind of techniques I've seen of science denial that people use on social media to mislead the public. The first one is conspiracy theories. And this is the one that actually drove me to social media in the first place. The COVID is a hoax conspiracy theories. And on the right-hand side of the screen, you can see my first two videos that ended up doing well. Like I started out just making videos for my own friends and family, and these two actually got shared, and like I got a lot of followers after these because these were trying to tell people that COVID is real. I mean, like if you would have told me a year before this that I would be online trying to teach people that a pandemic that's happening is actually real, I would not have believed you. But so the first conspiracy theory was that all the deaths were being miscoded. So I'm doing a video in the front showing that, this is how you fill out a COVID death certificate, and COVID isn't the first cause of death on the death certificate. There's other things. And that doesn't mean, like if they have ARDS on their death certificate, that doesn't mean it's not a COVID death. So that was the first video. And then I go through often, I probably have about 20 videos of excess mortality to show that we didn't have this excess mortality before March of 2020. And then all of a sudden we have it. So there's me pointing to the excess mortality. And then of course I put it on the bottom that's updated to the current day. And in fact, we still have excess mortality in the US. So there's a lot of conspiracy theories that, there's some kind of new world order or deep state. I'm always accused of working for the deep state. I still haven't gotten my check, unfortunately. But yes, conspiracy theories are what originally drove me to social media. They're very deep rooted. There's more than just these ones, but they're very hard to snap people out of once they're in them. Cherry picking is another method that's used often. And here's a mainstream media example actually of cherry picking, where people will take one data point that supports their position, whatever they're trying to say, and ignoring a body of evidence that is, so this news story is saying that, Pfizer vaccine is 39% effective, but at that current time that we had, I showed the data points from different places that the 39% was one data point, and there was actually a range in the body of evidence that showed that that was just one outlier. Fake experts is another way, the very effective way to spread misinformation. People are really likely to rely upon ideas offered by experts, right? But sometimes people don't actually have the knowledge or resources to know if this person is a real expert or not. And you see this a lot on YouTube videos. They'll hold up somebody that's like Dr. So-and-so, and they're talking about, you know, masks don't work, and you realize they're a doctor of like education or something. And this is very common. People will send me these videos, and you just do a quick Google search and realize this person is not an expert on infectious disease. So these fake experts will always be sort of the same brand of information. It's often they have secrets the government doesn't want you to know. They use dodgy references, YouTube videos, or something like that. Miracle cures, anecdotes, or appeals to emotion or fear. There's a lot of pseudo medical jargon that sounds right to a lay person. They will claim that mainstream science is intellectually compromised, that doctors are getting paid to, you know, by pharma or something like that. There's claims that they're being censored or silenced, and they never have any data to support their claims. It's always opining about possible side effects, but there really isn't any, especially about the COVID vaccines. We hear a lot of, oh, this could happen, but we really don't have any case studies supporting some of the things that some of them we don't even have one reported case. Then coordinated disinformation campaigns. This is incredibly insidious because a lot of times misinformation will be written up like a scientific publication, and it'll be either uploaded to a preprint server with no intention of ever submitting it for peer review, or sent to a kind of sketchy journal like this IPAC one that is, this IPAC journal publishes a lot of anti-vaccine studies, and I'm using quotation marks on that. So they purposefully plant this information just to cause confusion and chaos in an already bewildered public. So this particular study was over the summer, and it said that, or over the winter rather, and it said that, you know, the vaccine was causing miscarriages. And they reanalyzed CDC data, which they didn't have patient level data to do that in the first place. But basically they did, you know, bad methodology, garbage in, garbage out, terrible, not correct. So then you can see that the garbage article with the incorrect methodology and incorrect conclusions then was amplified on a fake news website. And from here, it just went on and on into the social media realm, right? People will repost this link that pregnant women should not get vaccinated because, you know, they're having miscarriages, which was not true. And in fact, reality on the bottom of the screen is that the CDC issued a health alert for pregnant women because they're at higher risk for severe outcomes and death from not being vaccinated if they get COVID-19. So this was an incredibly insidious example of disinformation targeting a very vulnerable group of patients, pregnant people who really want to do everything right to protect their baby. Appeals to fear is another really successful way, and as you probably all know, VAERS misinformation is their main weapon in this fight. So VAERS conspiracy on social media are rampant. And if you don't know, VAERS is the Vaccine Adverse Event Reporting System, which anything that happens after a vaccine, you can report to VAERS. Even if you fall down the stairs after you get a vaccine, you can put it in VAERS and it will be in there and people can find it. There's lots of just different types of events. Anything that happened after a vaccine, it's fair game. It's not, you can't say that anything in VAERS is caused by the vaccine because they'll accept any reports at all for things that happened after. So you can see this is a real comment in black. It's like, what about the vax deaths? They hid from us 43,000 deaths within 3 days. Like, just people believe this stuff and comment it on my page. So, you know, and then people on the bottom, another very common one is to compare COVID vaccine adverse events to older vaccines like the flu and say, well, there's 50 times more events with the COVID vaccine. So this, if you compare it to flu, but we've had the flu vaccine for years and we know what to expect from that. So there's really not as much, doctors and people aren't as incentivized to report those events because we kind of understand the flu vaccine and we have that one pretty well understood. A new vaccine is not really so much like that. So VAERS, I've spent a lot of time talking about VAERS on my channel. There are lots of videos on social media, and I've hid this person's identifying information, but there's a lot of videos of people showing a vaccine side effects, saying vaccines are dangerous. And because of these algorithm-driven platforms, these go completely viral and get into these echo chambers. This particular example, when I screen capped it, had 11.5 million views. And if you clicked on the link in this person's bio, she was raising money to help herself recover from her vaccine injury. GoFundMe has since disabled and refunded all of these donations that she got because they found this to be fraudulent. So these types of videos go completely viral on social media. And the misinformation is dangerous, take care before you share slogan is from the United Nations Verified Initiative. And this is the type of video that they are trying to target. These kind of videos that are not, they're just made up. They're not real. Another whole section of misinformation is logical fallacies. And one of the most common logical fallacies used is the base rate fallacy. That is when people just compare, and this happens all the time. I see it every day. Raw numbers of vaccinated versus unvaccinated in a highly vaccinated population, and it provides a very misleading view of vaccine effectiveness. So this is presenting numerator information without any context. So you can see there's 3 examples on the bottom. The most common is in the middle, remember, over 4th of July 2021, where 74% of people in the Cape Cod Provincetown COVID outbreak were fully vaccinated. And you thought, oh my gosh, the vaccine doesn't work, right? But this is a paper that these are some analyses I did with Israeli data that we published in The Hill, where you can see that if you look on the left, the green line is the vaccinated population. So if you just take the numbers, it looks like the vaccine doesn't work. But if you actually adjust for the base rate, which is the rate per 100,000 in the vaccinated and the rate per 100,000 in the unvaccinated, and you use proper denominators, you can see that actually the rate of vaccination, the rate of severe disease in vaccinated people, the green line on the right, is like pretty much flatlined to the bottom, and it's much higher in the unvaccinated. But if a population is mostly vaccinated people, it makes sense that numerically there will be more sick people in the vaccinated group, because that's what the population demographics are. Another technique is impossible expectations, which we also call black and white thinking. So this is using something not being perfect as a reason to dismiss solid evidence that they work. So you see this with all the mitigations in public health, but masks don't work. They use vaccine breakthrough cases as a reason that vaccines don't work. No mitigation is ever, or medication or anything is 100% effective. And it's when I combat this line of thinking, I always use the Swiss cheese model on this slide, in that, you know, multiple layers improve success. And when we have a time in areas and times of high transmission, we need more layers of Swiss cheese. and in times where it's not so high of transmission, we need less. And this is a really nice conceptual way to get people to understand that, you know, just a mask alone isn't going to work if you're in an area and time of high transmission. But if you're also vaccinated, you also have the windows open, you also are social distance, like all the layers together work better, right? And just like I always say to people, in a car, you have airbags, you have a license, you have speed limits, you have you have all kinds of things, you know, that keep you safe. And it's not just one thing, it's a bunch of things together. And so I like to counter the black and white thinking with sort of this more nuanced view, and people do seem to understand it because it's conceptual. Oh, I saved the best for last. False balance. This one is extremely, extremely effective. When a science issue is pretty much settled, presenting sources from quote unquote both sides, as if the science community were split on the issue. And this, you guys probably maybe all heard about when we wrote, my colleagues and I wrote an open letter to Spotify to call for them to put more misinformation moderation on their platform, because there was they have a creator, Joe Rogan, who had 11 million subscribers at this time. I think it's probably more now. And he was having guests on his show that were just kind of talking very blatantly about COVID-19 misinformation. And so it was pretty shocking. The day that his Robert Malone episode came out on New Year's Day of 2021, so December 31st, I got that video sent to me about 500 times by my followers. And finally, I was like, okay, I'm going to sit down and listen to this. And we were like all shocked. So a bunch of us got together and wrote this open letter from the science and medical community. Rolling Stone picked it up, and then it kind of just exploded from there and became global news. And, you know, it didn't really have so Spotify did put in, you know, a coronavirus hub where there's information about COVID. They labeled information about COVID and gave people a link to go to. But I really do feel proud that, you know, so that happened. But I never thought of the fact that we would start kind of a global conversation about misinformation, medical misinformation on these platforms, because it really did. And we were picked up by media all over the place. And this was an example of false balance, because when you have misinformation streaming on a platform of that size, it seems to people like there's two sides to the scientific evidence, when really there's not. The actual data shows that the vaccines are safe and that they work. And, you know, all of the other information that was being presented was not correct. So who's doing this? Why are they doing it? So the Center for Countering Digital Hate has put this report together where they analyzed information on social media and tried to trace the information back to the source. And they found that 65% of the anti-vaccine content is linked to 12 individuals. And why do they do it? So their social media page serves as sort of a storefront for a $36 million industry, which has only increased over the pandemic. They sell books, coaching, supplements, beauty products, telehealth, medicine, non-evidence-based treatments. And the beauty of this business model is they don't even need a sales force, because people share their memes for free. It reminds you of the snake oil salesman of the 1890s. I would be remiss if I did not bring up America's Frontline doctors, who sell telehealth visits to get ivermectin, a non-evidence-based treatment. There is now a group called No License for Disinformation, which is trying to get people who are not treating per the guidelines and actually treating not non-evidence-based treatments to lose their license if they're spreading misinformation and not treating appropriately. So misinformation about COVID-19 and the vaccines actually kills people. These people are examples, you see them all the time on social media. Since the vaccine's been widely available, we've had hundreds of thousands more deaths from COVID. And we know that the vaccine saves lives because with 2 shots, it's 10 times more likely to die if you don't have the 2 shots versus if you do. And the booster saves even more lives. It's 20 times more likely to die without the booster, without 3 shots versus none. So the conclusion here is that misinformation and disinformation is very prevalent on social media. There's a need to counter the bad information with good information. Social media algorithms provide fertile ground for viral misinformation. There's a co-epidemic of misinformation during the pandemic, and that social media has been used to weaponize health information for nefarious intent and agenda setting. And I hope, oh yes, I do have time for your questions. Great.
Thank you so much, Dr. Wallace. And I know you had a lot of content to get through, but we did had some questions come in. So
I tried to speed up at the end.
No, I've got the slow Southern drawl, but when I know I need to pick it up, I can definitely kick into that higher note. So I'm going to pull up our Q&A window here and just start going through from top to bottom some of the questions we've had come in. Just take them as you will. So the first one was really quick and simple. What is a dodgy reference?
Oh, thank you. So anything that's not, that's a good question. So it could be a YouTube video, something that doesn't have actual scientific references in it. Oftentimes people will send you a YouTube video to kind of give you, like you'll say, well, give me some example of what you're talking about or send me a reference, and they'll send you a YouTube video. So I guess it's something that's not peer reviewed or not an official scientific report.
Excellent. And thank you, Julie.
Or at least based on one, right?
Right. No, it makes perfect sense. And thank you, Julie, for sending in that question.
Yeah, that's a good question. Thank you for that clarification.
Are you finding that disinformation and even misinformation has increased as the world has opened up and incorrect logic is used, especially as we see higher profile persons who are vaxxed and boosted testing positive, with some folks inferring, going back to your false balance, I believe it was the impossible expectation slide. And can you expound on that a little bit?
Yes, as the virus has mutated, there's been more impossible expectations, right? Because people at the beginning, when we first got the vaccines, they were 95% effective against infection. And we've had several mutations in the virus since then. And because of that, as everyone on this call probably knows, the vaccine is less effective against infection. It is still very protective against severe disease and death. And that's what we have to keep. And it is still, actually, if you look, when you have your PDF version of the slides, if you look at the last 2 slides that I went over that just show the differences, it's still like 2.5 times more infections in unvaccinated groups. So even in infection, it is preventing infection. It's just not as good as it was before Omicron.
And so next up, doing a little research on my end, you've got the hallowed blue check mark on Twitter and on Instagram. And so we have someone who asks if you respond to any comments, positive and negative, on social media, and if so, how you determine which ones to respond to. And I would imagine probably in greater detail which ones to ignore.
So I've gotten, in the last 2 years, I've gotten very good at spotting disingenuous questions. You can tell when somebody's really just vaccine hesitant and wants more information, or if they're just like, well, how do you explain this? And then they post some kind of link to some kind of crazy thing. So it really, like, I'll respond to, if I have time, I'll respond to everyone that I see. And sometimes I'll just respond with like the eye roll emoji, because I've seen the same questions over and over again. But if it's a person that really wants information, I will answer them. And a lot of times people will send me DMs on Instagram if they're really hesitant, and because sometimes people there's a component that they don't want their friends to see that they're thinking about getting vaccinated. So a lot of times I get secret DMs from people.
Absolutely. No, I'm sure that makes perfect sense. Next up, we have someone asking, do you engage in proactive debunking? And if so, do you have any metrics that show if that strategy is successful?
So that's a great question, and it's something that I've been asked before. I do work on proactive debunking, and right now what we do is every month, as some of you may know, a group of kind of anti-vax physicians have asked the government for a freedom of information request for the Pfizer submission for their vaccine. And every month, a drop of 55,000 pages gets released. And every month, there's misinformation that comes out of that. So what we will do is just kind of get on top of that right away and try to figure out what's been in the documents, what the documents mean, why it's not, because a lot of it's safety information and a lot of it's misconstrued, and people that are not, just lay people are taking these documents because they're available to the public, things that really have no additional information besides what was in the product label already, but they're going around and saying it's secret, things that they're keeping secret. So we do try to get on top of that right now every month, which is a lot of work. But in terms of the metrics, I only have metrics in terms of like what people are telling me. And so I'm sure that from, like, I saw your video and I got vaccinated, and my aunt got vaccinated, or my coworkers or something. And I just assume that for everybody that tells me that there's more, but I don't have any hard and fast numbers of how successful it's been, to be honest.
Dr. Wallace, switching back over, we've got a specific question from Hillary asking if you're seeing much or any of these misinformation and disinformation tactics being applied to Paxlovid or monoclonal antibodies. But I was going to open that up and just say, what are you seeing as some of the main trends right now, or the main targets of mis and disinformation beyond kind of the heavy hitters like vaccines and things of that sort?
So I haven't seen a lot about Paxlovid. I definitely have seen remdesivir misinformation, that remdesivir is actually what's killing people in hospitals. And so it's just ridiculous. So I've definitely seen monoclonal antibody misinformation. I would say that probably right now, the main stuff is these Pfizer things and like hidden adverse events, hidden deaths, and like all this garbage. We see a lot about ivermectin still, even though there are so many studies now showing that it doesn't work. We see a lot about that. A lot of people still trying to get ivermectin, and it's just really unfortunate that even happened.
All right, we'll try and sneak one more in. I know Chris is going to cut us off right at 1 o'clock. Big picture, do you have one or two best practice tips when it comes to engaging someone who's being impacted by mis or disinformation?
I do. I think like I was showing in that kind of theoretical model, is that the false belief model is so complicated and it's so heterogeneous, the reasons people become vaccine hesitant. So really the best thing to do first is just ask, why are you thinking this? Like, what is the reason you're hesitant? Because it's going to be different for everybody. And then when they tell you what their exact hesitancy is, then you can pick whatever data that you have in your arsenal to kind of try to help that person. Because some people will say, well, I don't want the ingredients, the toxicity. And you say, well, the adverse events that happen after a vaccine are not actually because of ingredients. It's your own immune system building immunity, and it's your own body causing the reaction. It's not toxic ingredients. Like sometimes people just need you to explain to them based on their own hesitation. You can't just be like, well, the vaccines are effective. They're saving lives. Like they're tuning that out because there's something else that's bothering them, So yeah. You really need to boil down what the exact hesitancy is and then attack it on an individual basis.
Well, that's great advice. I know we are now right at 1 o'clock. Dr. Wallace, thank you so much. We held on to 450 right there till the very end. Thank you everybody for participating. Please complete our evaluation when it pops up, and please join us for our next event with Dr. Wu from the Atlantic on May 11th. Thank you all so much.